Welcome to Shared Decision Making for Aging Veterans. This is Shared Decision Making Team Training 1, the second component of a three-part orientation and training series for implementation of this program. The series is intended to start with a leadership orientation, a brief orientation session for Veterans Administration Medical Center leadership, including the Medical Center Director, Director of Nursing, Director of Social Work, as well as leaders of the clinic or service line implementing shared decision making. After that orientation, Shared Decision Making Team Training 1 is offered. Shared decision making is a collaborative process that involves the entire care team, so this training is for the entire care team, as well as administrators and support staff of any clinic or service line that plans to implement shared decision making. If you are completing this training independently, we hope you will encourage others in your clinic or service line to also complete the training. If your leadership is not yet on board with implementation, we hope you will introduce the program to them. Implementation is most successful when entire care teams complete the training. Shared Decision Making Facilitation Training 2 follows the team training. It is a practice-based training designed for those most involved with facilitation of shared decision-making discussions for aging veterans. While Shared Decision Making Team Training 1 and Facilitation Training 2 are tailored for VA staff, if you work in a non-VA setting, you may find that these trainings are also valuable for you and your organization. There are 2 6-minute videos embedded in this online training. Watch the videos in their entirety in order to go to the next training section. To activate the videos, click on the arrow icon. There are many valuable references and additional resources for much of the information provided in this training. They can be accessed by clicking on the magnifying glass icon in the lower right corner of many of the slides. At the end of the training, there is a quality improvement assessment and an opportunity to provide feedback. Thank you for taking time to do this, as it will help us improve future trainings. This team training covers an overview of shared decision making and why it is especially helpful to aging veterans making choices about long-term services and supports, a tour of the Office of Geriatrics and Extended Care's website, www.va.gov/geriatrics. An introduction to shared decision-making tools, materials, and distribution options. The team approach used in shared decision-making and roles of care team members. Discussions about goals. And a summary and next steps to implement shared decision-making for your aging veterans. Let's get started with an overview of shared decision-making. So what is shared decision-making? It is a collaborative, patient-directed decision-making process that works best for preference-sensitive choices, decisions for which the patient's goals and priorities play a considerable part in choices that are made. Preference-sensitive choices are not applicable in situations where personal preferences are unlikely to affect the final decision. For example, if someone has acute appendicitis, there is not much need for a shared decision-making process because the decision about what to do is not preference-sensitive. It would be rare for someone to reject surgery for acute appendicitis. Aging veterans, however, frequently face preference-sensitive topics such as choices among long-term services and supports and advanced care planning. Decisions about these topics are preference-sensitive as they are influenced by the veteran's goals and preferences. Shared decision-making is a collaborative process in that it involves the veteran, the family caregiver, if the veteran has one and wants them to be involved in making collaborative decisions, as well as multiple members of the care team, and finally the social worker who serves as the key facilitator of the collaborative process. Shared decision-making is patient-directed with decisions based on what matters to the veteran. And the veteran fills the role of final decision-maker. Shared decision-making is an evidence-based approach. There is a large and growing evidence base for shared decision-making as illustrated by this table. Overall, shared decision-making, including the use of decision aids, is linked with better outcomes for patients and families, including improved knowledge, feeling better informed, and increased involvement in decisions and care. Click on the icon at the bottom of this slide to see the research references on shared decision-making. Shared decision-making aligns with several VA initiatives. Click on the arrow icon to watch a 6-minute video about VA leadership support of shared decision-making. Now let's review why our focus is on older veterans. Almost half of the veterans served by the Veterans Health Administration are over 65. Indeed, about 70% of all people over 65 will need long-term services and supports someday. Those over 80 are the fastest growing cohort, and these veterans are the most likely to have multiple chronic conditions and to need long-term services and supports. Research with older people, some conducted at VA, has found that older people want to be asked about what is important to them, as do most people. Having the veteran clarify their goals is very important. Making assumptions about what the veteran or their family wants is not good practice. Older people want to be involved in decisions even when they say they do not. People may resist participating in shared decision-making discussions, but involvement is usually appreciated in the end. And older people have preferences that may change over time due to changes in their health status, the status of family caregivers, stress, and other factors. The goals, needs, preferences, and choices of the veteran and their family need to be revisited frequently. Research also shows that older people want information about home and community-based services. In the past, people's awareness was often limited to nursing homes, and nursing homes were often seen as a place for old people to go to die. Home and community-based services support people in remaining independent in their own homes. Older people need to learn about these services and how they can support them in meeting their health and life goals and priorities. Older people, and especially veterans, are often accustomed to following their provider's orders and not voicing their thoughts or opinions. This is one reason it may be difficult to get older veterans and their families to voice their choices. And last, research has shown that older people have lacked tools, such as decision aid worksheets, and a process, like shared decision-making discussions, to facilitate veteran-directed decisions. This situation has made it particularly challenging for older people and their families to make patient-directed choices. One goal of the shared decision-making process is to shift the veteran's role and the interactions with care team members from a medical model focusing on provider expertise toward a process of patient-directed decisions. As we move across the spectrum from the more traditional medical model toward patient-directed care, we move through a place of patient-centered care. This is care that focuses on the needs of the patient, such as a Saturday clinic for those who work an 8 to 5 or on weekdays. Patient-centered care is important, but it does not address how decisions are made. Patient engagement begins to address involving patients in the decision-making process. We engage them in discussions. However, this may still fall short of having them be the central decision maker. When we implement patient-directed care, we go further by saying that not only is the patient involved, but the patient is in charge, and that ultimately the decisions are theirs. The website tour will acquaint you with shared decision-making resources and tools available online. Now you will take a tour of the Veterans Health Administration Office of Geriatrics and Extended Care's website, and in particular, Your Guide, which contains information designed specifically for veterans and their families. Your Guide supports independence as we age by providing comprehensive information that supports the use of home and community-based services to age in place. Click on the arrow icon to take a tour of the Geriatrics and Extended Care website. As you saw on the website tour, there are many resources and tools available to assist veterans, caregivers, and staff in the shared decision-making process. Now you will see the print materials that support this process. Then you will learn about a range of distribution options to get shared decision-making folders in the hands of veterans and caregivers who will benefit from them. The decision aid worksheets are an important part of the shared decision-making process. You may already be familiar with conventional decision aids used to make choices among screening or treatment options. These decision aid worksheets are different in that they are not oriented toward a specific illness, test, or treatment. They are self-assessment tools, not assessment tools for medical conditions. They are designed to guide veterans through the shared decision-making process, assist veterans in setting their goals and priorities, and then to consider the range of long-term services and supports that can assist them in meeting their goals. They can be filled out by the veteran or be used as a conversation starter in collaborative discussions. And they support independence as we age, commonly known as aging in place. The Caregiver Self-Assessment Worksheet is also a self-assessment tool. It can help a family caregiver assess their roles and responsibilities, evaluate their stress and well-being, identify possible action steps to take, such as learn more or obtain support related to their role as a caregiver, and this decision aid worksheet may prompt readiness for participation in shared decision-making discussions. Advanced care planning is another topic for which shared decision-making is well suited. Leadership and staff at a number of medical centers have told us that they like to use the shared decision-making process for advanced care planning discussions with all of their patients. Advanced care planning discussions involve preference-sensitive choices, such as deciding who would make decisions for them if they were unable to do so. And they involve collaborative discussions, as veterans need to convey their preferences to the person who may be making those choices for them, as well as to their health care providers. The website tour also introduced you to the broad array of advanced care planning information. Here you see the Advanced Care Planning handout with information on one page and a values worksheet on page 2. And just like the shared decision-making decision aid worksheets, this worksheet is for the veteran to use and then to serve as a guide for advanced care planning discussions with providers and social workers. Here you see folders with printed materials which should be given to all veterans and family caregivers engaging in the shared decision-making process. They contain an overview of long-term services and supports, abbreviated from the website, the veteran and caregiver decision aid worksheets, handouts on advanced care planning and well-being, as well as a wallet card with a place for providers and social workers to jot down their contact information on the back. In addition, there are bookmark-style brochures available for placement in racks, exam rooms, or waiting rooms. There are many distribution options for the shared decision-making folders. The folders can be given to all older veterans or to any veteran or family caregivers who will be engaged in discussions about choices related to long-term services and supports or advanced care planning. They can be mailed prior to a clinic visit, used during the discharge planning process, or taken on a home visit. These hard copy materials are particularly important for veterans and family caregivers who do not use computers. For those who do use computers, most of the handouts in the folder can be downloaded from the Geriatrics and Extended Care website. Now that you're familiar with shared decision-making resources and tools, let's talk more about the team approach, staff roles, and how your care team can work together to implement shared decision-making. It takes collaborative team involvement to get to veteran-directed decisions. All staff has a role in encouraging veterans and caregivers to engage in the shared decision-making process, communicating with each other, and making referrals to social workers, providers, mental health staff, and chaplains as appropriate. Encourage all veterans to be involved in the shared decision-making process. Initially, they may say they don't want to be involved, but research shows that over time, they actually like being involved. So support veterans to clarify what is important to them, their personal goals and priorities, obtain and use comprehensive information about long-term services and supports, advanced care planning, and other topics relevant to them, such as well-being. Use the decision aid worksheets to facilitate collaborative, veteran-directed decision-making, and respect their decisions. Let's review the roles each of us can play in this process. Social workers are key to the shared decision-making process and are often the team member with the most skills for facilitating shared decision-making discussions and the most time allocated for having those discussions. Shared decision-making tasks that are usually addressed by social workers are to ensure that discussions with the veteran start with identifying what is most important to the veteran, to work with the veteran to involve family or a family caregiver as appropriate, to use the decision aid worksheets to facilitate conversations about the veteran's needs and priorities and resources, and given these topics, how best to achieve their goals. To ensure veterans are aware of the full range of long-term services and supports, particularly home and community-based services, which are important as they support veteran independence, which is what many older people want. To encourage veterans to talk with their provider if they have questions related to their health or the likely course of their illness. To support the veteran in making choices for themselves. And finally, to ensure referrals are completed. As we all know, simply making a referral is often not enough. Social workers may need to follow up with those referrals and make sure they become operational and that the veteran knows how to use them. Nurses often introduce shared decision-making to veterans and their family caregivers by providing them with a shared decision-making brochure or folder. They may also screen patients for participation in the shared decision-making process. Nurses may also encourage veterans and family to review the Geriatrics and Extended Care website. They can give the veteran a brochure with the website address and suggest that the veteran and/or their family review it. They may give the veteran the shared decision-making folder and review its contents, as well as encourage veterans and family caregivers to complete the decision aid worksheets or at least to review them. It is useful for them to convey the value of these worksheets to the veteran and their family, to explain that completing and discussing these worksheets among themselves will lead to more beneficial discussions with the care team and better choices for them. Nurses may also note whether or not the veteran and their family seem to understand the veteran's health conditions. If there appears to be any lack of understanding, the nurse may provide more information and/or encourage the veteran to talk with their provider so that they thoroughly understand their health conditions and how those may affect their functional status. And very importantly, the nurse can arrange for an appointment with a social worker. As social workers are usually the key facilitators in the shared decision-making process, this visit can be very beneficial for the veteran and their family. First and foremost, providers need to discuss the veteran's health status and any disease prognosis so that the veteran and family caregiver have some idea of what to expect going forward. When the veteran's concerns are addressed and they have a clear understanding about their needs, they are in the best position to set realistic goals based on their health status. Shared decision-making discussions can help veterans clarify goals and priorities, especially when prolonging life is not the only goal of care. Providers, particularly physicians, influence their patients' decisions. For this reason, providers can have considerable impact by encouraging their patients to participate in shared decision-making, recommending veterans and family explore the Geriatrics and Extended Care website and/or folder, and very importantly, encouraging them to review and, if possible, complete the decision aid worksheets. The worksheets encourage patients to think about their goals and preferences so they are prepared to have a longer discussion with their social worker. Providers have limited time, and social workers are often more skilled in facilitating conversations with patients about their goals and preferences and suggesting choices that meet those goals and preferences. So providers can facilitate veteran appointments with social workers and other care team members, coordinate with other medical care team members prior to making recommendations to the veteran, or reinforce what nurses or social workers recommend, make referrals to long-term services and supports that align with the veteran's goals, and accept the veteran's choices, even when they do not reflect the provider's judgment. The family caregiver or caregivers may or may not live with the veteran, and the relationship may be more or less positive. In most cases, caregiver involvement should be encouraged. Caregivers may play a role in supporting the veteran as the key decision maker. The caregiver self-assessment worksheet is helpful in the process of assessing needs and capacity for providing support. It is possible that caregiver input may affect the veteran's choices about advanced care planning or long-term services and supports, such as which services are needed, or even options for where the veteran lives while receiving services. Caregivers also have a role in talking with the veteran and communicating their capacity for providing support, including limits related to caregiving. And caregivers may participate in discussions about the veteran's advanced care plan, as they often have a key role in its implementation. The veteran's role is to be the key decision maker. The first step in this process is for the veteran to identify their goals, needs, and priorities. In order to clearly understand their needs, they often require additional information about their health conditions from their provider. The veteran also needs to have comprehensive information about long-term services and supports and to complete the Veteran Decision Aid Worksheet. Then they can discuss their goals, needs, and preferences with their care team, family caregiver, and social worker. And it's only at this point that the veteran will likely be ready to make veteran-directed decisions. Even with team participation, good information, and good training, shared decision-making discussions with older veterans can be challenging. To support collaborative, patient-directed discussions, start with goals. Veterans' values inform their goals, and shared decision-making discussions can help veterans translate their values into goals. Goals are rooted in values. Goals describe living according to what matters most to the veteran. Neither patients nor most healthcare team members are skilled at discussions about goals, but by focusing on two main questions, you'll be able to facilitate veterans' participation in a collaborative shared decision-making discussion about what's working well in your current healthcare and the way you manage your conditions, and what bothers you or is burdensome about your healthcare. Whether it's the veteran, family caregiver, physician, nurse, social worker, or other healthcare team member engaging in the collaborative discussions, to be effective, meaningful goals will be based on values which are linked to what matters to the veteran, specific by deciding exactly what to do or not do, realistic, meaning that what the veteran desires is doable, measurable, meaning they have deadlines or ways to check on progress, included in a plan where time has been spent thinking through barriers and how to get around them. And last, meaningful goals are flexible, meaning they can be revised as needed. You'll want to check to be sure that choices about long-term services and supports align with goals. Focus on strategies on maintaining independence. Try openers like, let's talk about living with Parkinson's, or whatever the veteran's conditions are. It is critical to ensure that the plans made and the selection of long-term services and supports, sometimes within VA and outside of VA, are directed at achieving the veteran's stated goals and preferences, what matters to them. Ideally, the veteran's choices are supported and respected by all care team members, even when the veteran's choices may not be the ones you would want the veteran to make. And you'll want to encourage ongoing discussions because both health status and goals can change over time. There are also many challenges associated with talking about topics related to aging. They are difficult topics. Communication barriers with older adults may be caused by aging-related health problems, such as hearing or vision deficits, dementia, side effects from medications such as fatigue, etc. Low health literacy. Over 60% of people over 65 in our country are at a basic or below basic level of health literacy. Denial about declines in functional abilities, or just not wanting to talk about the aging process because they are uncertain or afraid. Or a serious dislike for talking about getting worse or dying, or changes they may have to make related to requiring assistance for activities of daily living or to accommodate declines in function. And they can also be caused by environmental issues like background noise or lack of a private space for a conversation. Strategies for overcoming and effectively dealing with these communication issues are a key part of Shared Decision-Making Facilitation Training 2. Now let's review a summary of the 6 key components of shared decision-making for aging veterans and then next steps for implementation. In sum, shared decision-making for aging veterans can be used for making choices, any choices, but particularly those preference-sensitive decisions about topics that frequently address the needs of our aging population. When applying the shared decision-making process to decisions about long-term services and supports, be sure to, number 1, identify what matters most to the veteran. Encourage the veteran or any older person to identify what is most important to them, their goals and priorities. Clear goals make it possible for the veteran to make choices that support their goals. Number 2, provide access to comprehensive information and decision aid worksheets and tools. Comprehensive information about the range of long-term services and supports allows the veteran and their family to make informed choices. Encourage use of both the Geriatrics and Extended Care website and the Shared Decision-Making Folders, which are excellent sources of this comprehensive information for aging veterans. Provide comprehensive information even if not all the services are available where the veteran lives now. Some veterans may choose to move closer to a family caregiver or to where they can obtain the service that best meets their needs. Number 3, encourage use of decision aid worksheets. They are useful tools to use in shared decision-making discussions to help elicit values and preferences, and they can help get the conversation started with family caregivers, providers, and social workers. Number 4, ensure the veteran understands their medical conditions. In addition to treatment options, the patient needs to understand the likely effects of their health conditions on their ability to perform daily tasks at the present time and as an illness progresses. An understanding of the likely course of their conditions may also affect the choices they make about long-term services and supports or their preferences in their advanced care plan. Number 5, support veteran independence. In addition to being aware of the full range of services, this may well require use of services in the community as well as those provided by VA. As time passes, the veteran's needs and preferences may well change. So revisit the mix of services and supports chosen on a regular basis. And number 6, the last component of the shared decision-making process is essential. Respect the veteran's choices. The veteran is the decision maker, as long as he or she has capacity to make decisions. Be sure to provide the veteran and their family with the best information available and with your professional expertise. As the key decision maker, a veteran may make choices that do not align with your best professional judgment. But in the end, a key component of shared decision making is that the process is veteran directed and that their choices are respected. Click on the button that applies to you and your team to learn about next steps for implementation of shared decision-making for aging veterans. For VA shared decision-making implementation sites, if you have taken this training as a required portion of shared decision-making implementation, please confirm with leadership which programs or service lines at your VA medical center or community-based outreach clinic will implement shared decision-making for aging veterans. Common choices include packed clinics, geri-packs, and home-based primary care. In some locations across the country, shared decision-making is being done as part of discharge planning, and some locations have even created designated clinics for shared decision-making. Also, be sure you know the start date for shared decision-making implementation. Confirm what, if any, screening criteria your clinic or service line is using to identify veterans you should engage in this process. Examples include all veterans over the age of 65 or who appear to have a need for services, all veterans who have not completed an advance directive, by an assessment score, or by target population, such as veterans with multiple chronic conditions, those with a chronic progressive disease and live alone, who have weight loss, multiple missed appointments, especially those due to transportation challenges, or those presenting, veteran or caregiver, with complaints about being able to meet basic or instrumental activities of daily living, such as bathing or getting dressed. Key staff involved in facilitating shared decision-making discussions should complete shared decision-making facilitation training 2. While social workers are the key facilitators and in many locations are taking the lead to adopt the shared decision-making process, we have another training that is especially for social workers and others who view themselves as key facilitators of discussions, such as primary care providers, nurses, and other specialists, if appropriate and time allows. This case scenario-based training provides skills and practice for carrying out this challenging work. If you are part of a VA shared decision-making implementation site, this training will be provided. Last, obtain the shared decision-making folders from your clinic or service line leadership. Be sure to visit www.va.gov/geriatrics soon. Explore the information, resources, tools, and links about all aspects of shared decision-making for aging veterans, from long-term services and supports, including home and community-based services, to well-being, paying for long-term care, and advanced care planning. And recommend that the veterans and family caregivers you work with take time for a visit. Now, please complete the Quality Improvement Assessment questions to ensure we know that you have completed this course and to help us improve it for future participants. Thank you. Thank you for completing the Shared Decision Making for Aging Veterans Online Team Training 1. Whether or not you work at VA, if you have questions about or interest in shared decision-making implementation, please email us at sdmagingveterans@va.gov. We look forward to hearing from you.